Warning, censorship. Warning, censorship. Warning, censorship. Warning.
Hi everybody, how you doing? It's great to be with you. I'm sorry I was away the other day. You're not even going to believe me. It's sort of a dog ate my homework excuse. I actually have a dog and he was quite sick and I had to take care of the dog, which I'm not really used to doing, and I had to leave. So my good friends David Menzies and Sheila Gunn-Reid took over for me, and I'm pleased to say the dog is doing great. He's a better dog than ever. He's a good dog. He's a good dog, and sometimes, you know, you got to do things like go and take care of a dog. Just saying, that's why I wasn't here the other day. So I'm grateful to my friends for filling in for me. I have come to the conclusion, unhappily, that Canada is the most locked down place in the world in the name of the pandemic. I mean, obviously North Korea is a more oppressive place to live than Canada. I'm not saying it's not. But I mean, in terms of COVID excuses, North Korea is locked down because it's a communist, totalitarian regime run by a cult messiah complex, you know, madman. It's not locked down because of the pandemic. Young Lincoln Jay, one of our reporters we sent over to the United Kingdom a couple weeks ago. I'm so jealous when I see his reports. He's so clearly in a society where the masks are coming off and freedom's coming back and the pubs are open and the gyms are open and people can still wear masks if they got that psychological hang up, but he says that the scolding isn't there. Pretty sure he told me that on the tube, when they have an announcement, they say there are exemptions for masks that aren't necessarily visually apparent. So if someone's not wearing a mask, don't assume they're not exempt. I thought that was amazing that they would put that in the announcement. That's a way of saying, don't be mean, don't scold, don't hate. Boy, Canada could sure use some advice like that, eh? That's the United Kingdom. The United States, it's just, you know, they're done. Texas. How many people in Texas? More than 20 million, right? We mentioned that the other day on the show. Texas population, 29 million. Wow. Wow. That's almost as big as California. And Florida's got to be around 20. So you got 50 million people, Florida, Texas. And they're done. Not only are masks not required, it is illegal for any local official to have a mask requirement. In fact, in Texas, I know this is going to sound incredible, in Texas, any government official that tries to mask you, $1,000 fine for the official. And Ron DeSantis, the governor of Florida, has pardoned anyone charged with the mask offense, social distancing. He's pardoned them all. Just, there's not going to be any trials, hearings, convictions. Just done. And did you know that Texas was so big? Did you know it was, what did I say, 29 million people? Did you know it was that big? I thought it was around 20 million. I guess, I mean, listen, there's 50 United States. How do I know their populations? 29, that is coming up on the size of Canada, really. California, 40 million, huge, still number one by size. But even California is dialing back on the mask mandates because Gavin Newsom, the hard left-wing lockdownist governor, he's being recalled. So he says, oh, maybe I shouldn't be such a tyrant. Put that tweet back up. You were exactly right. That's exactly the tweet I had in mind. Texas is prohibiting mask mandates by government entities. Starting May 21st, local governments attempting to impose mask mandates can be fined up to $1,000. We're also prohibiting public schools from mandating masks after June 4th. Texans, not government, should decide their best health practices. Now, that's interesting because that's what they're doing, but can you find the stat that said for the first time in a long time, not a single COVID death, cases, all the other measurements at the lowest it's been in a year kind of thing? There's a great tweet and it's I don't know who did it, and it's illustrated by a jam-packed baseball stadium. So it's not that these folks in Texas are living a locked down life. The opposite. They're out and about in ballparks, sitting cheek by jowl, as they say. Texas has just reported 0 COVID-related deaths, fewest COVID cases in over 13 months, lowest 7-day COVID new cases rate, lowest COVID hospitalizations in 11 months. And guess what? Texas ended all COVID restrictions 10 weeks ago. Look at that ballpark. Justin, do you wish you were there? I wish I was there. And I'm not even a sports enthusiast. I know everyone thinks I am, because I just don't stop talking about the players and the teams, and I know all the sports trivia. Yeah, I once used the word here in the I used the word. I can't believe it. It just came out. I was just thinking, instead of stadium or arena, I said sports theater. I said it once, and they never let me forget it. But it's true. It's true. I'm so unsportsy. But wouldn't you like to, I don't care if you're a sports aficionado or not, who wouldn't want to be out in a lovely afternoon, retractable dome open, ball game, guys selling hot dogs, people wearing their sports jerseys, you're sitting bum to bum next to some guy next to you, you don't even know him, how are you, how you doing, great, isn't it great to be out? That is normal life. Oh, and what do we have up here? We have a staffer here from Nova Scotia originally, and she says you can't even go from town to town, let alone outside the province, let alone outside the country. You're not allowed to go past your closest grocery store. I haven't looked deeply into these rules, but I've heard things like this. So you are not allowed to go past your nearest grocery store. What are you, a prisoner? Are you a prisoner? About 1 million people in Nova Scotia. There's no scientific connection. Yeah, let's read this. This is Nova Scotia. May 10th of May. Nova Scotia's border is closed to people moving. It's closed to people moving to the province? So if you sold your house in Toronto and you bought a house in Halifax, you can't go? Nova Scotia's border is closed to people traveling for non-essential travel from Prince Edward Island and Newfoundland and Labrador. The border was previously closed to non-essential travel from other provinces, territories, and countries. So you just can't go in there. You can only enter Nova Scotia for essential travel or if you're a permanent resident of Nova Scotia. Retail stores that are permitted to provide in-person shopping need to limit shopping to 1 person per household. If needed, the designated shopper can have their children or a caregiver with them. That's so generous. These prison wardens are so good to me. Rotational workers returning home from COVID-19 outbreak zone must self-isolate for the period of time they're in the province, up to 14 days. All counties need to follow province-wide restrictions and protective measures. Avoid non-essential travel outside your community. Gathering limit indoors and outdoors is no more than your household bubble, the people you live with. Smaller households up to 2 people can socialize with 2 additional people, but they must be the same 2 people all of the time. So you're in solitary confinement. It's not even prison. Sure, what were you highlighting before? Avoid non-essential travel outside your town. Faith gatherings are not permitted. Just not at all. Just not even at all. Not even 1 person. Wedding ceremonies and funerals can have up to 5 people, plus the person conducting the ceremony. Receptions and visitation are not permitted. So the wedding ceremony, does that include the husband and the bride, the groom and the bride? Gathering limit and social distance for mental health and addiction support groups, 10 people. Public schools, pre-primary and private schools are closed. Meetings and training indoor hosted by a business or organization are not permitted, including governments, including first responder organizations. What? Meetings and training hosted by a business or organization are not permitted, including first. I think I'm reading that right. Like you know, organized performing. I don't know. Performing arts and sports are all banned. Virtual gatherings and performances are permitted with a maximum of 5 people. Businesses and organizations are not permitted to host events and activities indoors or outdoors. Businesses and organizations offering a wide variety of indoor recreation activities, like a play place, must close. Indoor fitness gyms must close. Outdoor fitness, up to 5 people maximum, maintain physical distance of 2 meters. Adult day programs for persons with disabilities must close. Got it. So the disabled can't do any programs. Got it. This is for your health, people. Adult residential centers and regional rehabilitation centers licensed by the department are closed to visitors. Residents are not permitted to leave the facilities. Okay, so that's a jail if you're not permitted to leave the facility. Long-term facilities, care facilities are closed. The visitors and residents are not permitted to leave, so that's jail. They're literally not permitted to leave the building. That's what that says. That's what regulated and unregulated health professions can remain open if they have an approved workplace COVID prevention plan. Museums are obviously closed. They can offer pickup and drop off for books. Personal services obviously closed. The casino's closed. I'm actually surprised. First Nations gaming establishments closed. I'm really surprised. VLTs are closed. Liquor is open, of course, but just for takeout. Bars are not permitted to host activities. Restaurants, takeout or delivery. Wearing a non-medical mask is required in an indoor setting with kids. This is basically a prison. Wearing a non-medical mask is required outdoors when a distance of 6 feet can't be maintained. It's a prison. The whole province is a prison. Can you go to the COVID stats? So the most shocking thing there is if you have the unhappy bad luck to be in a long-term care facility of any sort, a senior's home, whatever, you are not allowed to leave at all for any reason. You saw it. I just read it to you. That was from the Nova Scotia government site. You cannot leave. Sorry. Just not allowed. Everyone else can go into the prison yard, but you're not even allowed out of the ward itself. Now, Nova Scotia, okay, what's one of these hard to see graphs? How many people are in hospital? The 2 things I'm most interested in. 87 people are in the hospital, is that a fact? 20 in ICU. So you got 20 people in ICU at a province of just under 1 million. What's the total death count in this province since the beginning? 83? Total death 74. Average age is 80. So in 14 months, a province of approximately 1 million people has had, did you say 74 people pass away? So it's approximately 1 person a week. Average age is 80. and they surely have serious comorbidities. I don't think, I mean, I don't know every stat for every province, but I'm pretty confident saying there haven't been any young people who've died there because it's so very rare. So they're banning weddings with more than 5 people, even though the average age of death is 80. And you have one in a 1 million person, can you give me the exact population? Did we look that up together today? It's like just under 1 million, right? So you got 1 million people, one of them passes away a week. And that's sad, but of course, thousands of people die. Yeah, just under 1 million. Thank you for that. So I'm going to estimate that every year 10,000 people die, just in terms of percentages. You need to do annual deaths, Nova Scotia. My guess is it's 10,000. That 1 in 100 people dies in any given year. This is a rough number there.
Yeah, it was just under 10, around 9,500 every year.
9,500, that's not a bad guess. What do you think of that as a guess? Am I a good guesser? Yeah, thank you. So just under 10,000 people a year die. And I'm sorry, but people don't live forever, and thank God we don't. And we can have a philosophical discussion on that later. We want people to live, yeah, so Nova Scotia, it's about just under 10,000 a year. We don't want people to die young. We don't want people to die violently. We don't want people to die preventably, but nor do we want people to live forever. We want people to live a happy, full life and have a meaningful life, and you don't want to live to be 150. You don't want to live to be forever. My point is, if you have 10,000 people who have died in the last year, and of course the pandemic's been around for more than a year, so you're probably at 12,000 people who have died of all causes in Nova Scotia since the pandemic began, and 74 of those 12,000 are from the virus. And the average age of those 74 is 80, and the average comorbidities are 3. Why are you banning weddings? Why are you banning all churches? Why are you banning sports activities? Why are you banning all retail? Why are you turning people into prisoners? That's got nothing to do with the fact that 74 people in the last 14 months died, average age 80. I'm sorry. That's Nova Scotia. Ontario is just as bad. Not quite as bad about rules not traveling from place to place, and I haven't heard about treating people as prisoners in seniors' homes, so it is not as bad in Ontario. But it is awful. I mean, the lockdown, in terms of the stats, can we go to the Ontario stats page? You know how to find that one? Why don't we go to the national stats page? You know, the Theresa Tam one where you just type, where they have the provinces, you just mouse over them. I want to take you to a page, and we've shown you this one before. I find this page useful for a few things. None of these government stats pages are very useful because they don't want to be useful, because they want to emphasize alarmist facts and they want to minimize hopeful facts. That's my view. So the one that, you know, just COVID stats can, no problem. And you have to know what to look for. So you don't care about cases. What's a case? You care about deaths or hospitalizations, in my mind. A case, what's a case? Someone tested positive. Are they even sick? Or they just was it just like a weekend flu like Trump had, and then they're better? I'm not worried about that. I'm worried about the very serious cases, the hospitalizations, and the deaths. Even though I acknowledge that the average death, depending on the province, 80, 81, 82, it's actually higher than the life expectancy. I was thinking the other day, I don't know if you saw my show, Alberta had a request for proposal asking private security companies to bid on sending out spy drones to find people hiking and camping and backpacking. One of the best things about Alberta, yeah, this is the one. Can you zoom in just a little bit? And now, so you see it says count of cases. We into the super quick battery switch. That was like a pit boss in a pit stop in a raceway at a sports theater, at an outdoor race theater. Yeah, stay on count and do 2 weeks. Why not? And yeah, by province and territory. And you have to click refresh or it's already refreshed. Okay, so now start in BC. Let's start on the west coast, the best coast. So case count. Okay, go up a little bit. Let me just make sure we're looking at things here. Count of cases. Oh, no, we don't want cases. Yeah, count, we want count, but not of cases. We want hospitalizations or deaths. Yeah, that's what we're worried about. Cases, you want more cases, do more testing, you get more cases. So this is the one we want. So you got to toggle the right things. You see what I mean about them giving you useless information? You got to go. So let's start with the far north. Not a single case. Not one. You see 0, 0, 0. Do you see that? Deaths. Pardon me. Thank you. Got to use my terminology. 0 deaths. You see that? Like none. Just none. Okay, let's go to BC. Now that's because they're a very low population. So BC. Do you see that chart on the right? Every time Justin moves the mouse over a province, there's a little chart that pops up. So you see he's just going province to province and you get a different one. So let's start in BC and go a little slower. So you see in BC, there was a spike over Christmas and it's down, right? That's what we call flu season, people. Go to Alberta. Same thing. Like, do you see how the death rate, and we toggle it, death count in the last 2 weeks, right? The count, so that's the number, of deaths, not cases, over the last 14 days. Like a 14-day rolling average, I think that's what that means. Saskatchewan. You see all of them have the same shape. Look at that. That's a perfect shape. What place is that? Manitoba? So Manitoba, that is okay, and what's Ontario like? So so you had a spike last year, now you have a spike over Christmas. And what's Quebec like? Quebec is done. And can you find Nova Scotia on there? Nova Scotia, they really haven't had deaths in a year of any like 1 or 2. They had a bunch of deaths a year ago, right? Like out of the 74 that they've had, I think this suggests that 90% of them were a year ago. I think that's what that means. Is that what that means? So they haven't even had a crisis in Nova Scotia in a year, but they're locking down now? There were 5 in the last 2 weeks. Okay, thank you for that information. In 1 million people, you got 1 million people, you had 5 people pass away, average age 80, and you're locking the whole place down. How about some of those other small population provinces? Which one's that? New Brunswick? Okay, but again, the count is so low that if you have 2 or 3, it spikes up. Prince Edward Island, tiny place, just not even. I don't think anyone's actually died. I don't think a single person's ever died in Prince Edward Island from this disease. And then Newfoundland, again, you have like 3 little bumps there because it's so rare. So those are like individual. Three. Got it. So you had 3 deaths and then 1 death and then 2 deaths or something like that. And I'm not making light of any deaths. I'm just saying people die. 10,000 a year in Nova Scotia. And yet we have the harshest lockdown. The lockdowns I just took you through in Nova Scotia. That is more harsh than living in... Is that more harsh than living in North Korea? No. Because North Korea, you don't have any freedom. But North Korea doesn't have these pandemic lockdowns. I would rather live in Halifax than North Korea. But I would say, what am I doing in this prison? Can you go to an infographic that Doug Ford tweeted yesterday. So Ontario, so I grew up in Alberta, and we did not like the Ontario centricity, the Toronto-centric view of the world. I live in Toronto now, and my views haven't changed other than this. While I don't believe in Toronto centricity, I also must acknowledge the economic and demographic importance of Ontario. I'm not saying it's any better than any other place, any more morally important. I'm just saying if you are in a province or territory with, 1 million people, that's a serious place. If you're talking about a province or territory with 15 million people, which is Ontario, it will have a larger impact, a larger, the commerce, the industry, the banking, the media, the airports, the head offices, Toronto. It's one thing to go absolutely crazy and lock down Nova Scotia, which treats Nova Scotians very unfairly. But imagine extrapolating that 15 times more. I think the damage they're doing to Ontario in many ways is irreversible. Let's go to that infographic. So Doug Ford had this announcement yesterday. Roadmap to reopen, but you'll see it never goes to fully reopen. So the first thing you need to know is it's tied to the, quote, vaccination rate. Why are they doing that? Well, because I just showed you why. Because if it was tied to the death rate, they'd be free. People aren't dying from the virus in significant numbers anymore. It's over. The worst is over, thank goodness. And it's going to get even better now because it's sunny and people are outdoors and fresh air. And, this is really a kind of flu virus. That's why you had the spike in flu season. So you'll notice that they're pegging your freedoms to whether or not you take an experimental drug. Not whether or not the virus is dangerous. It's, are you taking the drug or not? Now, I can understand why, Bill Gates or Pfizer or Moderna would like this, but why would the general public? Can you pump up the side here? I'm going to try and read this. So, until 60% of people get injected with the experimental drug, and I say that because these drugs are experimental. I want people to, can you go to my pinned tweet for 1 second? Just for 1 second. YouTube is insane. If you say anything against the vaccine, they'll suspend you. They're just mad that way. But so I'm going to quote from Pfizer. Let me read you my pinned tweet. The vaccines have not yet been approved by the FDA. That's the Food and Drug Administration. They haven't finished being tested. The drug companies say this. Here's Pfizer's warning, for example. We'll read that in a second. These are experimental drugs authorized only for emergency use. How can a 12-year-old consent? Because in the region of Peel, just outside Toronto, 12-year-olds can, quote, consent. And I think it's probably the same in Toronto. Click on that Pfizer link. I just want to show the censors at YouTube. So you see this is an official Pfizer document, right? The facts about the Pfizer-BioNTech COVID-19 vaccine. The Pfizer-BioNTech COVID-19 vaccine has not been approved or licensed by the U.S. Food and Drug Administration, but has been authorized for emergency use by the FDA under an emergency use authorization to prevent coronavirus disease 2019 in individuals 12 years of age or older. The emergency use of this product is only authorized for the duration of the declaration that circumstances exist justifying the authorization of emergency use of the medical product under Section 564 of the FD&C Act, unless the declaration is terminated or authorization revoked sooner. The FDA authorization of the Pfizer-BioNTech COVID-19 vaccine for emergency use is a significant step forward, blah, blah, blah. What are the ingredients? They tell you what's in it. How does an mRNA vaccine work? Scroll down. do mRNA vaccines change a person's DNA? What are the side effects? And then you got to scroll down. Oh, it's a lot of vomiting, diarrhea, arm pain, swollen lymph nodes, nausea, feeling unwell. It covers a lot of ground. Fever, joint pain. What should I do about side effects? So you see this document. This is written by lawyers. Would you agree with me? This is a very defensive document. And I read that to you because I don't want you to think, oh, Ezra, what are you talking about? These vaccines are approved. Now, what was the very first sentence there? Put it back up, just in the very first sentence. The Pfizer-BioNTech COVID-19 vaccine has not been approved. NOT has not been approved or licensed, but it's been authorized for emergency use. This is from their own, and I can tell you, I've read it on the other websites too, AstraZeneca, whatever. They all say the same thing because they don't want to be sued. They don't want to be sued for false advertising. They don't want someone to say, you said this was approved. No, we didn't. We're testing it. We rush these out. This is a scientific experiment, and normally we finish the experiment before we jab it in your arm. Normally we run trials on people and we check things out and we tweak things, but politicians said get it out, so this is on them. That's what that says. And now, 12-year-olds can consent to taking this experimental drug that Pfizer itself says not approved, not approved, not approved, not approved, not approved. Don't think this is approved. Hey, 12-year-olds, do you understand these things? Hey, 12-year-old, not old enough to drive, not old enough to vote, not old enough to engage in certain contracts. You know, a 12-year-old can engage in certain contracts. A 12-year-old can go and buy food, for example, and be bound to pay for the food or whatever. But I remember this from law school, certain, for example, luxury things, like a 12-year-old can't go in, buy a bunch of stuff that are luxuries and be held to that contract because the law, I'm just going from memory for 30 years ago in law school, the law wants to protect people with reduced capacity, as in you're 12 years old. You didn't know you were buying that super stereo system for $1,000 that was only worth $100. Like the law will step in and protect children. It'll protect adults who have reduced cognitive abilities. So we protect 12-year-olds. 12-year-olds are not allowed to marry because they're not mature enough to be married, and they can't make the grave decision of getting married at age 12. I'd have to look up a list of all the things a 12-year-old cannot do. A 12-year-old is under the guardianship of his or her parents unless they become a, quote, emancipated minor, which they have to go to court and have a judge say, yeah, you're tough enough to be on your own. A 12-year-old is not a legal adult. A 12-year-old is limited in many things they can do. And a 12-year-old can now consent without talking to their parents about taking this experimental jab? Really? Really? And getting back to the Doug Ford roadmap, his roadmap is not based on death count or hospitalizations or ICUs, which I may disagree with, but at least there's some rationale there. His reopening map is based on how many people got the jab. What's that got to do with anything? Vaccination rate, 60% with one dose. Hey guys, outdoors first with limited, well-managed crowding and permitting restricted retail. So only 10 people meeting outside, up to 4 people per table for eating outside. So if you've got 3 kids, you've got to leave one at home. Essential retail at 25%, non-essential retail at 15%. Outdoor religious services if you're spaced out. Outdoor sports for up to 10 people. Day camps, campgrounds. And then you have to wait 21 days till the next step, even though, hang on, I thought they said, what if 70% of people get the jab? So it's the later of these two. And what's this got to do with how many people are sick or dying? Open indoors with small numbers and face coverings and expand outdoors. So 25 people outdoors, 5 people indoors. Wow, They're actually allowing 6 people at a table outside. You're such a generous prison guard, Doug Ford. Essential retail 50%, non-essential 25%, and they'll tell you what that is. If you think you're essential, you're not the decider. Outdoor sports, outdoor things. Okay, what's the next one? 21 days. So now we're 42 days in the future. So that's another month and a half. 70 to 80%. Hang on, I thought it was. So is it the days? Is it the percent jabbed? So it's not about who's sick anymore, and it's not about we got to flatten the curve so we're not overwhelming the hospitals anymore. It's, hey, listen, Pfizer's got to make some money here, people. Will you give a thought to Big Pharma? So 42 days from now, if enough of you jab yourself, there will be indoor dining if the prison guard says you've been in good behavior. Stores will open if you're being good. Indoor meeting will open if you're being good. Some outdoor activities will be allowed. Scroll down a little bit more. Larger indoor religious services. What does larger mean? How many? Essential and non-essential retail open with limited capacity. So there's no, that's it, right? That's the whole infographic? That's the whole thing? Thanks. So there's no plan to get you 100% out. There's no plan to end this. There's no plan to end the masks. There's no plan to end the limits on commerce. You'll notice, so importantly, it is not linked to health outcomes. It's not linked to, oh my God, we got to flatten the curve because we don't want to overwhelm the hospital. It's not linked to that at all. Where did you see anything about that? It's how many of you had a jab, and can we kick this far down the future? You can't, oh no, you can't rush. Look, someone put 21 days on an infographic. So, science, people. Well, look, the science said put the number 21 on an infographic. So some intern said we have to wait 21 days, and then we have to wait another 21 days. That's just science. And what has that got to do with health outcomes? Well, economics is a science, and Pfizer sure would like it if you took another jab. And then you're going to need a booster for that. And there's the new variant. There's 200 countries in the world. So you got your UK variant, you got your Brazil variant, you got your India variant. So unfortunately, Pfizer, no one is less happy about this than Pfizer. But unfortunately, you're going to have to be getting jabs for a long time because that's what the government is measuring. When I worked at the Fraser Institute as an intern, they had a motto, which is good for a think tank. Their motto was, if it matters, measure it. And that was one of Rudy Giuliani's rules of thumb when he was mayor of New York. So, for example, Rikers Island, which is this big prison in the city, he was tough on crime, but he didn't like the crime in the prison. He didn't like, for example, the violence against prisoners. Prisoners were raped in prison. Terrible things happened in Rikers. It was notorious. You heard of Rikers Island? And that's like a byword for a terrible, terrible prison, right? Like, I don't care if you're from New York, you've probably heard Rikers Island. You probably heard it in the Al Pacino voice. Because especially in the 70s and 80s, that was regarded as the worst place to be put. I don't care where you were in the world, if you heard Rikers Island, you would have thought it was some terrible place. It was in New York City. If I'm not mistaken, it's right there in the river on a little island. Give me LaGuardia. Like when you're landing in LaGuardia, you fly right over Rikers. Give me an image. I want to show people how, like go to Google Maps and show people Rikers. So Rudy Giuliani, this tough as nails prosecutor who put away the mob, got tough on crime, and then he became mayor and he got tougher on crime on the streets, and he really led to so Rikers, I pull out a little bit and then click satellite view. Because I want to see zoom in a bit. So you can see the airstrip there. Do you see that airstrip? That's LaGuardia. It's my favorite airport in New York. And then zoom in to Rikers. You can see, zoom in a little more, and look at the shape of the prison. Like it's just like those little X's. You see that? That's Rikers Island. Those are different wings and compound. Like that's and it's a good idea to have a prison in an island, I think. It's like Alcatraz. Yeah, you don't want to be in Rikers Island. One of the worst places in America. That's Rikers. Right in the heart of the city, right? But it's on an island, so you wouldn't sort of think about it. You see it when you, like imagine coming in on that, yeah, you can see Manhattan there on the left. You're flying into LaGuardia. Anyone who's gone in and out of LaGuardia, you probably saw Rikers even if you didn't know you were looking at it. Very interesting to me. Rudy Giuliani in his book, which I read, took that principle, if it matters, measure it. And he said, I want updates from Rikers on the number of prisoners who were assaulted, the number of prisoners who had violence done to them. Like he said, I want a regular report. I don't know if it was monthly or even weekly. And so the message was sent, the mayor cares about this. Okay, and let's say it was 50 violent incidents this month. The mayor would expect that to be lower next month, and then lower the next month. So simply by demanding that the city government measure certain things, if they were good things, there would be pressure to make them go up. If it was bad things. So Rikers Island, if I'm remembering his book, it's been 20 years since I read it. You wouldn't think a mayor, a tough as nails, anti-mob, anti-corruption mayor, prosecutor would care about prisoners. But he did, because a prisoner is sentenced to prison. A prisoner is not sentenced to random violence from other people. So Rudy Giuliani started to measure things, and they brought in that broken window theory of policing. So if it matters, measure it. I thought what mattered, 2 weeks to flatten the curve. What are they talking about? Well, if people get too sick all at once, we're going to overwhelm the hospitals. Wasn't that what they said right at the beginning? So flatten the curve meant, so it didn't mean stop the curve. It meant flatten it so we're not all going to the hospital at the same time. Can we spread it out, slow it down? So sure, people are going to get sick, but we'll have plenty of hospital beds for you. That's why they opened up temporary hospitals in places. That's why Donald Trump sent down those 2 U.S. Navy hospital ships to LA and New York, just to help offload regular patients from the hospital so they could take these COVID patients. Those boats were never used. Did you know that? Those ships were never used. The USS Mercy, I think, and the USS Comfort, I think, were the names of those boats. Maybe I got those wrong. So what matters with this virus? Well, I would think the number of people who die matters. That's why we got to make sure we're measuring people who die from the virus, not die from diabetes plus dementia plus a heart attack plus a stroke, but they happen to have the virus, so it's measured that way. So if it matters, measurement. People dying from the virus, that matters. We've got to measure it. The demographics of who dies, how old are you? That's very important. A year or so ago, we didn't know that this was really a disease of the very old and the very sick. Would we have changed how we approach schools? I don't know. Does it matter if you're so sick you go to the ICU, the intensive care unit? Yeah, that matters. Let's measure that. Does it matter if you're so sick you just go to the regular hospital? Yeah, that matters. But what did you see on the infographic we just showed you? What mattered? What were they measuring? What were the two numbers you saw? Number of people getting a jab, and scroll down to the bottom, time. Okay, so those are unrelated. I showed you the charts of every province, the death rate plunging once we were out of flu season. It had anything to do with vaccinations. Almost no one in Canada had a jab in January. Almost no one. Almost no one had a jab in February. And yet the death rate plunged like a cliff. We showed you all the charts. And time, why did you just make up 21 days? Is there a magical reason for 21? Is it, because that's the blackjack number? Is there some feng shui rationale behind it? Case rates, which I think are BS, at least that's in some way rooted to the sickness. But vaccinations is just a commercial decision and an experimental decision. And time is just an arbitrary number. Doug Ford's reopening plan never commits to a full opening. You saw that even in the final version. There's still limits on retail, still masks, still limits on things. They never want to get out of this. There's no basis on actual morbidity or mortality. That means people getting sick or people dying. It's completely unmoored from health outcomes, and it is now about perpetuating the lockdown. And by the way, I don't trust Doug Ford as far as I can throw him. Now, is this a better or worse lockdown than the one we showed you from Nova Scotia? Well, the one in Nova Scotia was just purely insane, surely illegal, absolutely unconstitutional, and maybe we should find a lawyer and challenge it. We don't have a strong viewership base in Nova Scotia. I'd like to find a client there. I'd like to find a lawyer there. I'd like to challenge it. I got to tell you, of all the parts of this country where we should be stronger, the Atlantic Canada is it. We're very strong in Ontario these days. We're very strong in Alberta, proportionately. I think it's our strongest place. We've had an amazing growth in Quebec because we're the only people talking about what's going on there. But the Atlantic, I hate to say it, we haven't really covered things in the Atlantic well. We don't have people on the ground to tell those stories well enough, and I wish we did. And I wish we had a lawyer, probably in Halifax, who would sue that insane lockdown, a lawyer and a client, and we would crowdfund it through Fight the Fines. Can I put out an appeal? Let me do this. We can find a lawyer. It's not hard to find lawyers. There's thousands of lawyers in Halifax. If you can help me find someone to be the client, have them send me an email to Ezra at rebelnews.com or go to fightthefines.com. I want someone who's been ticketed or in another way punished for violating these insane North Korea-style lockdowns. And I want to fight. I want to do a constitutional challenge on their behalf. I'll find the lawyer. You find the client, I'll find the lawyer. Is that a deal? We've got to do something. Don't you think we have to do something? If we don't do it, who's going to do it? We've got to do something. I just think we've got to do something. How can I not do something? I haven't been to Halifax or Dartmouth in a while. I like it. It was there that I first got, what do they call those in music? You can't get an earworm. Is that the phrase? Earworm? I got the earworm, Baird's Privateers. Here I am 20 years later. I can't get it out of my head. For 20 years, that song's been in my head from the lower deck in Halifax. I sing it wherever I go. I've gone deep, way too deep than any man should, down the sea shanties. Surely I owe Halifax more than just an out-of-tune rendition of Baird's Privateers. Anyways, help me out if you can. Tell me someone who's ready. We'll give him a lawyer and we'll crowdfund it. Is there a hero in, how many people live in Halifax? Probably about 600,000, am I right? Can you find one man, woman, or child in Halifax? 430,000? Now that's probably just Halifax itself, or is that the? Okay, there's a little. Okay, I think I'm probably right. Okay, well, I guess this is my way of saying I want to do something about Halifax. I just said to Margaret today, do we have anyone there who could hold the camera? But you know what? I don't even need that. I just need a plaintiff. I need someone who's willing to stand up. We'll cover all the costs. We'll cover the lawyer. We'll cover the expenses. We just need someone to stand up and say this isn't right. You know what? One of our first Fight the Fines cases was from New Brunswick. Walter Matheson. He got a ticket for sitting alone in his vehicle, drinking a Tim Hortons coffee, eating a muffin, windows rolled up, sitting by himself. He got a COVID ticket for that. That was one of our first cases. That's a great case. He was tough as nails. I had a couple phone calls with him. I was really glad. Boy, it makes me mad. We got a few hyperchats. All right, I'm going to look at these. And you're sending these to me on WhatsApp. All right, got to open that up here. Yeah, I don't think we're getting out of it in 2021. Do you? No. We're not. And I look at Texas, and I look at Florida, and I look at, like, there's so many states that have now banned masks. I think there's over 20. So I was showing you Texas, and I think the other day we showed Ron DeSantis in Florida. And those are very important states because they're very large. Those two states combine 50 million souls. That's huge. But every state's important, every person's important. And I think the number of states that have, oh, you know what? Google this for me. Pennsylvania emergency vote. Pennsylvania, sort of a purple state, went for Trump in 2016. Democrats took it in 2020. Democrat governor. They were sick of this. And they just had a, look at this. And this isn't even Fox, this is NBC, right? Pennsylvania voters become first in the United States to impose new limits on governor's powers. With 75% of Pennsylvanians in precincts reporting, the two questions, can you pump it up just a little bit? Led with almost 54% of the vote, more than 2 million ballots were cast. Here, let's just read the first sentence. Pennsylvania voters became the first in the nation to curb their governor's emergency powers, approving institutional amendments proposed by Republican lawmakers angry over Democratic Governor Tom Wolf's handling of the COVID-19 outbreak. The vote on Tuesday's statewide primary ballot came as Republican lawmakers across the country have sought to roll back the emergency powers governors wielded during the COVID-19 pandemic. Republicans see the referendum as a victory, with strong political overtones as the state gears up for a wide-open governor's race in 2022 and Wolf leaving office after 2 terms. Republicans in the state legislature and those aiming to replace him in 2023 have made Wolf their top political target, repeatedly attacking his stewardship to blah, blah, blah. The main point is, Pennsylvania, which voted Democrat nationally and statewide, said, yeah, you know, we don't like this. We're going to limit the powers of these deep state. Ballot question, legislative power over disaster declarations, passes 53 to 47. Ballot question, expiring in emergency after 21, same breakdown. So they're going to limit the powers. They're going to put a short fuse on them. None of this year-and-a-half permanent emergency. That's the kind of talk that you hear from Fidel Castro, the permanent revolution, the constant revolution. No, not in Pennsylvania. They're tired of it. In Ontario, Nova Scotia, they love it. Where's the opposition in either of those two provinces? Have they said a word? They have not. Oh, and the media loves it. Okay, let me read some chats. Hyperchat. Take down CCP. All right. Super U. My mom is in a long-term care facility in Nova Scotia. My sister's struggling with this. She can't visit her daughter at Dell. Sus Jan. I think we just found our plaintiff. I'm not even kidding. Email me at Ezra@rebelnews.com or go to fightthefinance.com. Maybe we'll take this case. That crypto club, please stop talking about COVID being real. Now, let me tell you this about COVID, in my view. COVID is a real sickness. It's a coronavirus. There are many coronaviruses. We sometimes, because maybe this is the first time we've heard the phrase coronavirus, we think that all coronaviruses are COVID-19. No, it's just one of countless versions of the virus. I absolutely believe it's real. In fact, frankly, I think I got it a year ago when I was very sick and I didn't know what it was. It was in December. I was traveling. It's a virus. And in the early days, there was propaganda from the Chinese government, so it was hard to discern what was real and what wasn't. It went through Italy very dangerously. And somehow the West went mad. And I think there was some excuse for it because we didn't know, is this Ebola? But after a month or so, it became evident it would not overwhelm our healthcare systems. And after a while or so, it became evident that this was not a disease with equal risk for every age cohort. I already talked about overcounting any deaths or any illnesses as a coronavirus. I think there's no doubt at all that it exists as a virus. I think the question is, now that we know more about it, why are we locking down the whole world? Now we know, first of all, who it targets, and second of all, the total levels of morbidity and mortality. We don't need to be in full Ebola mode. So I'm going to disagree with him on that. Rocks for Northeast. Ezra, you guys planning on pushing back when they implement a vaccine passport? Yes, absolutely. Super U, Red Rose 7734. There's only so many willing to take the jab. Now the rest will be blamed for closures. Do you have that Fauci clip when he was asked how many of his staff? Hyperchat, 5 libraries from Blue Jetty. Saskatoon police are publishing photos of people who attend freedom rallies. What a bunch of bullies, eh? I wonder if that's doxing. I wonder how those cops would like it if their photographs were published to name and shame them. I don't think they'd like it one bit. In fact, I think they'd probably arrest those who did so. You know, it's possible to defame someone with a photograph. It's absolutely possible. I wonder if those Saskatoon police would be cooled off a bit if someone they smeared through some photographic publication took them to task. I'm embarrassed for Saskatchewan how they've been handling this whole thing. Do you have that Fauci? Let me know when you find. If you search from Ezra Levant space Fauci, probably find. Then click the video toggle. You probably find it quick. It's 12:56, and I did not show you most of what I wanted to. But just a quick shout out to the people watching us on the different platforms. 1,492 people watching on YouTube, and I didn't properly log in to Odyssey, but let's just take a really quick look there. On Odyssey, we've got 73 people watching there. Nice to have you. On Rumble, I'm just going to log in there. I like Rumble. 2,367 people there. Oh, that's huge. And SuperU.net. We got 23 folks. I think we got to pump up SuperU again. Have they ironed out some of their wrinkles? All right. Well, yeah, we'll talk after. We got them. You know what? I know we sent out a big email one day and they had a little bit of a hiccup. No problem. They're a pretty young site. Any site that's got a headline, free speech channel, that's what they call themselves. That's got to be our home. Now, I love Rumble too, and they're out there just giving her. Rumble's had a bit of a head start. But, I know the guys behind SuperU. I love them. I've actually met the guys from Odyssey and Rumble too. And that's amazing because they really have time for independent creators, whereas YouTube really couldn't care less. We got to be out pretty quickly, so I want to show you this clip. Anthony Fauci, who has been one of the worst in this whole thing, he was recently asked, how many of your staff have taken the jab? And here's what he answered.
Okay, this question, I'm going to go to Dr. Fauci, Dr. Marks, and Dr. Lewinsky. What percentage of the employees in your institute, your center, or your agency of your employees has been vaccinated?
You know, I'm not 100% sure, Senator, but I think it's probably a little bit more than half, probably around 60%.
Dr. Marks?
I can't tell you the exact number, but it's probably in the same range. Some people vaccinated at our facility and others at outside of the facility.
Dr. Lewinsky?
We're encouraging our employees to get vaccinated. We've been doing town halls and education seminars. Our staff have the option to report their vaccination status, but as you understand, the federal government is not requiring it, so we do not know.
Now, it's not funny because I know the vaccination rate in the general public in the United States it's about that high. Some places higher. You would think that Fauci's own staff, like that's like the inner cabal, you would think they would be obsessed with vaccines. You'd think they would, like those are the triple maskers. Or maybe they know something we don't. I don't know. Why wouldn't Fauci's own people get vaccinated? Why wouldn't the folks at the Food and Drug Administration get vaccinated? Don't you find that odd? I mean, it would be like if you discovered that people working at a restaurant, half the waiters of the restaurant never eat there. So, well, hang on, I'm eating here. You're telling me the food's good and you literally refuse to eat in your own restaurant? Like, when I was in college, I worked in a restaurant, worked in Earl's Restaurant. Actually, my first job was at Callaway Park, Barney's Burger Bistro, and then the problem was I ate too much. You know, putting me at work in a restaurant was terrible, terrible planning by the bosses. If you can't eat, if you're not eating your own restaurant's food, why are you working there? And how can you pitch the dishes of the day to the staff? I mean, to the clientele. And if you refuse, like not just, oh, I can't afford it. Like, let's say you work at a very fancy restaurant and you just can't afford it. Maybe they cook you a little nibble or something. Okay, I can't afford it. This is the most luxurious restaurant in New York City. I can't really afford it. The cook whips up a little spaghetti for me, but I can't have caviar. I can't have champagne. Okay, now I have an understanding. But you're working at a regular restaurant, you won't eat the food, and you refuse to eat the food? There's a problem. You're working for Anthony Fauci, you're working the Centers for Disease Control, you're working the Food and Drug Administration, and you refuse to take the vaccine that you've shut down this whole country for? You're working for the agency that tells us we can't go to school, we can't fly, we can't work, we can't go outside. And you're saying that we have to, and you're not getting the jab. Oh, sure, I work at this restaurant, but I would never eat the food here. What are you, crazy? I find that bizarre. Well, my friends, it's 1:02. Time flies. I got to get cracking because I have to do a show for today, and we put out a show every statutory holiday, by the way, I got to tell you. So on Monday, there's a holiday in Ontario, but we got to do double work today. We got to get that going. Do you have a dog video? Is it your own dog?
No, unfortunately not.
Okay. Well, I want to let everyone know that Justin has a puppy also. And he has started taking puppy videos and publishing them. And I have watched 3 puppy videos. And they're great. That one, little Rupert, can I say his name on air? I just did. Rupert, who's so small, he's like a very small loaf of bread. Like if you bought a loaf of bread like that, you'd say, what's that, half a loaf? Like he's half a loaf of bread. He's tiny. And he was trying to get down, do you have that video? And he was trying to get down the stairs that were taller than him. And it was a great video. If it's a private moment you don't want to share, but it is on Rupert's official dog video. It is what's the kind of dog you got? A miniature schnauzer. I don't know the differences. It's just a cute dog to me. I'm going to say goodbye. Is this your dog we got here? This is a dog trying to go, this is Rupert trying to go down the stairs? This is a cute dog. I'll see you later, everybody. Come on.
Come on. Rupert. Come on. Come on. Come on. Come Come on. Good boy.